Hello, Miss Jones. My name is Patty. I'm your CNA today. How are you? Wonderful. I need to perform Peri care. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. I'll be right back. After washing my hands, I'll get my clean supplies. We're going to place the supplies on an overbed table, and we'll start with a barrier on the table, making sure that the absorbent side is facing up to catch any water spills. This gives us a clean place to put our clean supplies. For this skill, we're going to need 2 chucks. We'll need a towel, 4 washcloths, 1, 2, 3, 4, and a privacy blanket. We'll go to the patient area. And now I'm going to get a basin and soap. We'll place this on the overbed table. And I need a set of gloves. Now I'll go fill the basin. Miss Jones, I'm going to go get some water. I'll be right back. To fill the basin, I'm going to use a paper towel to turn the faucet on because my hands are clean. I'll use my wrist to feel the water temperature. It should feel warm, not hot, not cold, just warm. And we'll fill the basin about 1/4 of the way full. Mrs. Jones, would you like to check the water temperature? It's good? Wonderful. I'm going to set this on the barrier. And this is a privacy blanket. This is going to keep you warm and protect your privacy while we do this skill. I'm just going to stretch it out over your sheet. And then I'll pull the sheet down underneath the privacy blanket. And we're going to pull the sheet down to about your knees. Now, I'm going to prepare my chucks. I'll unfold them, hold them up lengthwise, and I'm going to roll it toward me. Clean rolls toward me. All the way to the end. I'll put this on the barrier and do the same with the second. I'm going to open it up. Hold it up lengthwise with the absorbent side facing me and roll it all the way to the end. Clean rolls toward me. We'll set that on the barrier as well. Now I can put my gloves on. I'm going to place the washcloths in the basin to warm. I'll take one of the chucks that's rolled. I'm going to lay it up next to the patient under the soiled chucks. And Miss Jones, if I can have you scoot toward me, please. And we're going to roll up on your right side so I can change the chucks under you. I'll help you roll. Okay, now that you're on your side, I'm going to take the soiled chucks and roll it in. Clean rolls toward me, dirty rolls away. I want to roll it so that the absorbent side is on the inside and the waterproof side is facing up. I'm only going to touch the waterproof side, and I'm going to tuck it underneath the patient's hip. I'll unroll the clean chucks and tuck it underneath the patient's bottom area, under the dirty. Okay, Miss Jones, come on back. Thank you. And if you can scoot to the middle of the bed. Thank you. I'm going to go around to the other side. Go ahead and scoot toward me. Thank you. And roll up on your left side. 1, 2, 3. And I will remove that chucks, the soiled one, and smooth out the clean. We'll fold this up and we're going to throw this directly into the trash can. Okay, Ms. Jones, can you scoot back to the center of the bed, please? Thank you. I'm going to expose you now. I'll make this as brief as possible. Please let me know if you're uncomfortable in any way. I'm going to roll the gown inside the privacy blanket, and this will expose the peri area. And then I'm going to use a towel over the upper thighs to keep all of that area dry. Now we're ready to clean. I'll take the first washcloth, wring it out, and soap 5 corners. We're going to use the leaves method, meaning the free ends are at the top of the diamond shape. I'll spray the first leaf, fold it over, spray the second leaf, fold it over, spray the third leaf, fold it over, spray the fourth leaf, fold it over, and the back. I'll set that aside. Now I'm going to clean the peri area. I'll hold the washcloth in my hand in a diamond shape, tucking in the 2 side corners, making sure I have control over the leaves and they're at the top so that we can minimize cross-contamination. Okay, Ms. Jones, I'm going to start cleaning you now. I have to hold you open just a little bit, but let me know if it gets uncomfortable. So I'll take the heel of my hand at the top of the peri area, retract slightly, and spread her open a little bit. And I'm going to clean right down the inside middle, top to bottom, one direction only. Once I reach the bottom, we'll move away and fold that leaf over. I'm going to clean the outside peri area, top to bottom. Fold that leaf over. The other side, top to bottom, making sure I don't ever move back up. Fold that leaf over. The fourth leaf will go right down that skin fold, the crease between the thigh and the groin. We'll fold that over, and then we'll clean this skin fold, top to bottom, and we'll set that aside. Whatever we wash, we rinse. So I'll wring out my washcloth using that same leaves method, tucking in the 2 side corners. I'm going to retract the labia and clean top to bottom. Down the center, fold that leaf over. The second leaf will clean the outside of the peri area, top to bottom. And then we're going to fold that leaf over. The third leaf will clean the outside of the peri area on this side, top to bottom. I'll fold that leaf over. The fourth leaf will clean the crease, top to bottom. I'll fold that leaf over, and then we're going to clean this crease, top to bottom. And now we'll dry. Okay, Ms. Jones, I'm just going to unroll your privacy blanket, putting the gown back over your legs, and I'm going to ask you to scoot toward me and roll you on your side so I can clean your back side. 1, 2, 3, and we're going to roll up. 1, 2, 3. We'll expose your back side, and the evaluator will hold the mannequin in place for this process. So now I can clean the back side. I'm going to wring the washcloth out. And this time, we're going to soap 4 leaves. So 1, we'll fold that over. 2, fold that over. 3, fold that over. 4, set the soap aside. I'm going to start at the anal opening and move up the crease. Just like that. We'll fold that leaf over. I'm going to clean 1 buttocks. We're going to fold that leaf over, clean the other buttocks. We'll fold that leaf over, and then once more up the crease. We'll set this washcloth aside. Whatever we wash, we rinse. So I'll wring that washcloth out really well. I'm going to hold it in that leaves shape. I'm going to rinse right up the center crease. Fold that leaf over. We'll rinse 1 buttocks. Fold that leaf over. Rinse the other buttocks. Fold that leaf over, and then once more up the center crease. Now we'll dry those areas. So starting at the anal opening, we'll dry all of those areas. We'll set that aside. Now I'm going to take the new chucks, place it under the one that's on the bed, and we're going to roll this one toward the patient and tuck it under her hip, and unroll the new one and tuck it under the soil. Okay, Miss Jones, come on back onto your back, please. Thank you, and then scoot to the middle, please. And I'm going to go around and remove that soiled chucks. Go ahead and scoot toward me. And then we're going to roll up on your side, 1, 2, 3. So I'll remove that soiled chucks and smooth out the new one. Come on back onto your back and then scoot to the middle of the bed, please. Thank you. This will be thrown away. Okay, Miss Jones, you're covered. You're in the center of the bed. I'm going to go put your dirty linens away and clean the basin. I'll be right back. These items will go in dirty linen hamper. And I'll clean the basin the same way we clean all basins. We're going to dispose of the water into the sink. Rinse the basin. Dispose of the rinse water into the sink. Set it down. Disinfect it per facility policy. Use a paper towel to pick it up. Paper towel to dry the inside. Throw that away. Paper towel to dry the outside. Throw that away. And one for the drawer. On the way, we'll pick up the soap. Place it in the basin. Use the paper towel to open the middle drawer. Pick up the lotion and put it in the basin. And then store the basin in the drawer. We'll close it with a paper towel and then throw those paper towels away. We'll dispose of the barrier that's on the table. And then remove my gloves. Okay, Miss Jones, I'm going to pull your privacy blanket up and put your sheet back in place. We'll make sure that the patient is covered and that we roll the privacy blanket up in a ball as we remove it from the patient. I want to adjust the sheet for neatness and appearance. And I'm going to go place this in dirty linen. Okay, Miss Jones, are you comfortable? Is there anything else I can get for you while I'm here? Would you like a magazine? No? Okay, your environment is clean. Here's your call light. If you need anything at all, just press that red button and somebody will be happy to help you. Your bed is in the low position. I'm going to open your privacy curtain and go wash my hands. We'll return this table to storage before we go, leaving our area clean. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done.